Hello, I'm Dr. James Bogash, expert in health and longevity, and today we're going to talk about a study that was just published looking at masks and facial recognition and what that may mean. But I think we need to start with talking about how we're interacting with each other in general. I've heard people say that all of this is designed, like it should bring us all together as people. I just don't see it. More than ever, I feel that we are less trustful of each other, more standoffish, less less warmth towards one another. And this just, I mean, you can't smile at somebody anymore. You can't look at them. You can't show them your facial expressions. You can't smile at a child. They can't be seen. It takes a lot of smile to make it to the eyes. And for those of you that know me, and we've had this conversation, I don't smile on demand very much. And so that can be a challenge for me to express people what I may be thinking when I'm wearing a mask that covers a good chunk of my face. So and certainly in social media, we've been more divided now than ever. And I think that is, from a social standpoint, we're certainly more divided. From an individual standpoint, I feel, at least personally, I'm less able to interact with people that are around me when we're all wearing masks. You can't just smile at somebody and say hi and nod, whatever it would be, because most of your expressions are covered up. So it's like, what's the point in interacting when somebody can't even see you? And facial recognition, this shouldn't come as a big surprise, but there was a study that was recently published. Researchers looked at several hundred volunteers to see how well they recognize people, so facial recognition using masks. And the facial recognition was definitely reduced with the use of masks. That shouldn't come as a big surprise. What was interesting is they identified some people as super recognizers. In other words, they could use the eyes to determine somebody. Other people were hypo recognizers, and there's actual medical term for that, but those people absolutely couldn't tell the difference from people just from their eyes. I have a tendency to be more like, for me, I need the entire face. I've had long-term patients out in the waiting room that I don't even recognize them because of most of the face being covered up. So that's me personally. But the challenge is, so the idea that these researchers found that facial recognition was reduced with the use of masks shouldn't be a big surprise. But then the authors point out that studies have shown that people with age-related macular degeneration, which also leads to problems with facial recognition, lead to reduction in things like social engagement, social confidence, and overall reduced quality of life. So people just start to withdraw and suck into themselves because they can't identify other people and react to them. It's a serious concern going forward because we're now using masks in massive quantities, is not the right word, but at levels never seen before. Certainly surgeons have used these forever. We have certain cultures where we will use facial coverings that are part of that culture, but we're seeing things on a much larger scale than we've ever seen before. And I can't help but think that this is going to result in less interpersonal relationships and less closeness with our fellow man, which is clearly disturbing and problematic. So as always, I'll post a link to this study in the comments section. Make sure you share this video with somebody who you think needs the information, subscribe to the channel, and give the video a like.